Morning everybody. So we're going to talk a little bit this morning about something that we commonly see, or commonly asked in clinic, and something that was a recent post by Adam Meekins. So if you don't follow Adam, give him a follow on Instagram, although he's got millions of followers, so he probably doesn't need the follows. But if you want some more kind of in-depth information, there's some good links on there on a post that he put on fairly recently. So you've got back pain, do you need a scan? Is that going to be helpful? Few things to remember about back pain. It's multifactorial, which means it's caused by lots of different things. So it's not just something that's, you've prolapsed a disc, or you've strained a ligament, or you've sprained a muscle. There's a whole cascade of things that feed into your pain sort of perception, not just the tissue causing symptoms. What you think about it, how debilitating it is, how much it impacts your daily life. So to try and ascertain as a healthcare professional a tissue causing symptom, or a tissue that's likely to be causing your symptoms, is incredibly difficult, even in this day and age. So you'll see a healthcare professional, and good healthcare professionals typically are very considered in terms of what they say. Your healthcare professionals who are less concerned about something called nocebo, which is what we'll talk about in a second, might tell you that you've got a slip disc, which is impossible because discs can't slip. They're fused or they're attached to the vertebral bodies, so you get what's called a prolapse or a herniation, which is where your disc bulges. They might tell you you've got degenerative disc disease based on your age or based on a history of lifting and carrying. And these things then tend to manifest themselves in your head as the opposite of placebo, and then you start to catastrophize. It's called nocebo. Now, nocebo potentially starts to change the organization of your brain. So that pain pathway from your back becomes hardwired in, and then you start to then associate things like stress, anxiety with an increase in your back symptoms. This is how back pain becomes like hardwired in. So at that point, this is usually the place where a lot of people will go and see their GP or go and organise for private scans in the hopes that that scan is going to give them the answer. And in many cases, and I think in fact in most cases, scans are completely unnecessary. Scans, you often find when people come to see us who've had scans, the back pain they've got is usually attributed to perhaps a coincidental finding. So yes, they might have some thinning on the disc, something called spondylosis. They might have some signs of arthritis on the facet joints. They might have some degeneration in a number of discs, which would be classed as the degenerative disc disease, all of which you may have had for a number of years prior to your scan, and may not in fact be causing you actually any back pain whatsoever. This is the reason why I think back surgery is relatively unsuccessful, is because what you see on a scan and what the surgeon cuts out isn't always your tissue causing symptom. And often people wake up after back surgery in the same amount of pain as they were, or in worse pain than they were. And I think that's the reality of the complexity of back pain diagnosis. There are some situations where a scan is warranted. So if you have a history of cancer and you've got back pain seemingly out of the blue, and there's certain characteristics of that back pain which don't fit with your stereotypical mechanical back pain, which is usually made worse with activity and better with rest. Things like bowel and bladder changes. So if you've got changes, you're incontinent, you can't go to the toilet, or you can't stop going to the toilet, it's uncontrollable. Those kind of things definitely need an urgent scan, because they're what we call red flags. But in the most case, you'll tend to find most back pain episodes are mechanical in nature and will resolve within about 6 to 8 weeks with some hands-on and some exercise prescriptive treatment. Those people who've sort of delved into the chronic pain phenomenon, these are people who've had their pain for more than 3 months, they need to be approached slightly differently. And it's not just the exercise prescription side of things. Those people probably need some psychological support some CBT, some cognitive behavioural therapy, in order to try and break down. Think of your pain pathway like a path up your garden. If you keep going over that path, you're clearing it of moss and weeds and bits and pieces like that. CBT and psychologically aimed therapies allow the moss and the weeds to grow back over that path, and that reduces the speed of transmission of those pain impulses. So for those of you with your chronic back pain, it's not just, you know, rubbing the bit that hurts, it's a little bit more complex. However, without a scan, with a scan, the treatment outcome, potentially the treatment approach would still be the same.